I think that's it. Is that okay?
That also works. Yeah, go ahead.
Okay, so they're in the room. I'm really honored to be here presenting to this audience about two things that are near and dear to me, because both mental health and migraine have really been the foundation of my own professional practice for 20 years, I would say. And I have found it a very rewarding career and a very rewarding population to work with, and to work in the field of chronic pain as a psychologist, as a health psychologist. It's really wonderful. So I really love that I've been invited here, and I'm really happy to share whatever I can to be helpful to the efforts of Migraine Canada. So I think, Randa, we have a survey. I think I would move to our own little survey. It is a little bit of a repeat from what Randa started with, which was, if you join the call, can you please just, tell us where you're from? We have a question about where you are from. Want to see where people are from. Where are you joining us from? And we have all of the Canadian provinces covered, and then we have other to account for anybody who's outside of Canada or maybe in one of our territories. So if you can just take a moment, fill this out. This helps me also know who I'm speaking to, where at least you are from the people that are here.
Yeah.
Okay, I guess I should. I'm not sure if I answered that. I don't think I'm answering. Oh, hosts and panelists cannot vote. Okay, I tried to click mine, but it won't let me. So.
Yeah. Okay, we're getting, we got about 86% participation. That's great. I'm gonna end that so we can see.
Okay, Ontario and then Alberta. How interesting. So we've got, and then other. So we've got quite a few from outside as well. All right, well, wherever you're from, welcome here. Our second question, Randa, let's load that one up, is, are you someone that has migraines? So here comes the second survey.
1 second, I'm launching that. Go ahead.
Okay, are you a person with migraine? Yes or no? And we'll see, Randa, I'm sure you're getting quick responses in there.
Very quick, very quick. We got 94% participation. That's really great.
Let's see what the prevalence of migraine is among this group. Okay, 76% yes, 24% no. So when I speak about migraine, I am talking to people that know what I'm talking about from personal experience. All right, that's really, really helpful, those statistics for me to know. I'm gonna now switch over to just a few more opening remarks. Uh-oh, does not look like my slides are not advancing. Oh, there we go. Okay, maybe my technology deficit was concerning me there for a moment. Okay, so just a few opening remarks. I think that my goals for this talk are really aligned well with those strategic pillars that Randa was talking about for Migraine Canada, particularly around awareness and education. So I want to bring some education and information about migraines and mental health to you. I want to review the signs and symptoms of a mental health problem, tools for improving mental health, what options there are available for help, and then some tips for taking the next step, whatever that might be for you. And ultimately, my last point here is I want to provide people that are on this Zoom meeting some hope and encouragement. This is my ultimate goal. I want you to leave this time being encouraged and with some renewed hope that you're not alone, particularly if you are struggling with a mental health issue or problem. All right, so before we jump into the convergence of migraine and mental health, I just want to do a bit of a step back and let's look at just some basic statistics of both migraine as well as mental health. So, migraine prevalence in Canada, 15% roughly for women and around 6% for men. It's a really common health problem. For those that are from the US, I think the US is pretty equivalent, sitting at around 12% overall. And that's combined men and women. So really, really similar stats. And I suspect that the industrialized countries are all very similar with those prevalence rates. Now let's maybe look at mental health problems. And I did include these as pre-pandemic statistics because I'm going to show you the pandemic statistics in a moment, but pre-pandemic, what about mental health problems? In Canada, depression prevalence ranges between anywhere between 5.4% and 11.7%. And this is up to, get this is up to 3 times higher among young adults. So the 18 to 29-year-olds. We know that not just for depression and anxiety, but for a whole host of mental health problems, that young adulthood is a really vulnerable time. It's that transition between adolescence and adulthood that seems to be particularly significant in people's development of a mental health issue. So anxiety prevalence, a little bit less than depression prevalence, anywhere between 4.6 and 10.8% of Canadians. And the onset of an anxiety problem predates or comes earlier than a depression problem. And this makes sense developmentally because we know that anxiety often over time, if it's untreated or doesn't resolve, it makes a person more vulnerable to depression, which then comes in later. So it does seem like anxiety is a bit of a precursor to depression. It's not unusual. You talk with people who have depression and they will talk about it starting with an anxiety issue. And depression and anxiety go together far more than they exist separately. So even though these are 2 distinct problems, more often than not, they're like a double whammy and they occur together, which makes it really difficult. I am going to be focusing most of my slides, just as another kind of caveat here, I'm going to be focusing most of my slides on depression and anxiety and not some of the other mental health disorders or problems, just because depression and anxiety are the most common. And so I felt that we couldn't really include that umbrella for, everything. So we're just taking the ones that are typically the most salient. And I think especially now, because if we move on to looking at the pandemic statistics, this is where we start to see some of the things that probably people have already suspected or have experienced, which is mental health problems are more prevalent now in the midst of this pandemic than they were before the pandemic. So this information is kind of hot off the presses from Statistics Canada, which they are equipped to do these very large national surveys of the general population. And they did a survey of Canadians between September and December 2020. And they discovered that 1 in 5, which is 21% of Canadians, has a mental health problem. The depression prevalence was 15%, anxiety 13%. And then this phenomenon that we saw before the pandemic is still present with those young adults, still the most vulnerable and having the highest prevalence of all. So young adults up to 3 times higher prevalence of a mental health problem than older adults. If we break it down simply by gender, with women and men being considered, we have 1 in 4 women, 24% of women having a mental health problem in Canada, 17% of men, almost 1 in 5 men having a mental health problem in Canada. So this is a substantial leap from where we were in Canada pre-pandemic with those other statistics I showed you earlier. So this is significant. The pandemic has really been difficult for a lot of people. And this seems to confirm that. How about migraine prevalence in Canada in this pandemic? That's a question mark. But I'll tell you my suspicion, because migraine and mental health are actually quite linked, I would suspect that because we see a rise in mental health problems, we probably, if we did a national survey, we would also see that prevalence of migraine going up as well. So I think that we can safely conclude that both migraine and mental health problems are more significant in the pandemic. So if you've been struggling in this pandemic with more frequent migraines, more severe migraines, as well as more struggles with your mental wellness, you are not alone. You're not alone. There's a lot of people in that same boat. So let's keep on going. Now we're going to turn our attention to what I'll call the convergence between migraine and mental health. This is where we start to specifically hone in on migraineurs and mental health difficulties. What is this relationship like? So, not a surprise, there is a higher prevalence of mental health problems among people with migraines. How big is this difference? How much more prevalent is someone with migraine to a mental health problem than someone else who doesn't have a migraine? And this is the discouraging statistic. If you have migraine, your risk of developing depression and anxiety doubles. And that's a conservative estimate. Some studies show up to 4 times more likely to develop a depression and anxiety problem. At the Chronic Pain Center, when we looked at our clients, our patients in the Chronic Pain Center, those getting referred to that program, at least 50% had a significant depression or anxiety problem. So that's how high that prevalence was. So what we call longitudinal studies, so these are studies that follow individuals for a long period of time. They do show that there is this relationship between migraine and mental health that works in both directions. So we know that the presence of migraine increases risk for developing something like depression, and I would say anxiety can go there too. We can make that correlation as well, but it works the other way around too. The presence of depression or anxiety increases the risk of then developing migraine. So it's kind of like that double whammy that also goes together, where one makes the other worse, and then one perpetuates the other. And it's this awful reciprocal relationship going on between mental health problems and migraine. And often at the Chronic Pain Center, the question would be, well, which one came first? Was it the migraine or was it the mental health problem? And that, over time, that's actually often a moot question, because really what's most important is that both of these problems are given their own validation as issues that should be addressed in their own right. So increased screening has been recommended because of this bidirectional relationship between migraine and mental health problems, with treatment focusing on both problems. And that's why having a team approach for addressing migraine and mental health is often very, very good. Because if you can have someone that helps you with your mood and anxiety, and then have a physician that helps you with your migraines, and then maybe have another practitioner, I'm thinking of a physical therapist or an occupational therapist. I worked in team-based healthcare for many, many years, still do. And so I'm a big believer in a team. Now, if you can't go to a chronic pain center where you have this team available, I'm just throwing this in, this isn't even in my recommendations or later, you can build your own team. And I think that can be really helpful, is devise your own team of people, because you may need more than just one, particularly if your migraines are severe, frequent, and you've also got mental health issues that are emerging there too, which wouldn't be a surprise. All right, so let's keep on going. I've thrown around these words, anxiety and depression, mental health problem, but I've been really remiss in not actually defining them. Now, I don't want to spend a lot of time going over the clinical definitions of these things, but I do think it warrants just a little bit of clarity around what I mean when I say anxiety. So what exactly is anxiety? So when I say anxiety, it's not just normal fear and nervousness. Fear and nervousness, these are normal experiences, and I don't want to pathologize them. We actually do well when we have a little bit of stress in our lives. Actually, our productivity goes up. We're motivated to do things when we're just a little bit nervous or a little bit uncertain. These things can be healthy and good in our lives. When I'm talking about anxiety, moving into an anxiety problem, think of anxiety as having three components. And I'll call them the cognitive. This has to do with your thoughts, often related to danger or harm. The affective, which is like the emotions, such as fear or panic. And then the somatic, and that has to do with the body symptoms of anxiety. So you can think of panic symptoms in the body, which is like a rapid heart, shallow breathing, muscle tension, or just general restlessness and agitation, feeling on edge. So think about anxiety from the perspective of these three components. So when it becomes a problem, we can describe it as excessive. So that means any of these three components can be disproportionate to the situation that's being encountered. So a person's thoughts about danger or harm can be excessive or magnified, much bigger than is warranted by the situation. Their emotions, such as fear or panic, can also be excessive, like they're much bigger or magnified than what's warranted by the situation. Or their body symptoms can become magnified and excessive, disproportionate. Another characteristic is the persistence. So it's not only that these symptoms are excessive or magnified, but they last longer than is also warranted by the situation. So you can think about me giving this talk. I'm a little bit nervous, but let's say that I was so nervous that I couldn't speak or I was paralyzed. That would be an example of excessive anxiety. Or let's say after we're done our Zoom meeting, I hang up and then, tomorrow I'm still feeling anxious and I'm still feeling nervous and all that. That would be a sign of it's persisting much longer than it should be persisting. So those are both characteristics of what we would call an anxiety problem. So anxiety usually involves perception of a threat, and it's usually future oriented. I often characterize with students the difference between anxiety and depression. Anxiety is typically future oriented. It's all about what's bad that's going to happen to me. And depression is typically past oriented. It's ruminating about how I'm a failure, I've done bad things in my life, I've got shortcomings that I can't overcome, and it's more of a ruminative, past-oriented way of being. So this is one way to distinguish between anxiety and depression. And so if you think about anxiety and depression going together, it's sort of like the past as well as the future are both pretty difficult and impacting in negative ways. All right, but let's now move on to depression. What is depression? So I gave you a little teaser there. Depression, just like we can feel normal fear and nervousness, Same thing with depression. I don't want what's called over pathologized depression. Feelings of sadness, grief, loss, feeling down. These are normal human emotions. So that's not what I'm talking about when I say depression. When do these feelings, though, become a problem? So depression, you'll see I've got 9 symptoms listed here. And in order to be identified as having what we call a major depressive disorder, you have to experience at least 5 of these. And you'll notice that there's 2 with little asterisks. That means one of those first 2 has to be present. It's required in order, they have to be one of the 5. And you have to have these consistently for most of the day, every day. The starting point is 2-week period of time, which actually in my mind is quite short. Typically when I've seen someone who's struggling with a depression, it's been much longer than that, but 2 weeks is that entry point. If these things have been going on for in a significant way for more than 2 weeks, that's a sign that probably some help is needed. All right. I'm not going to go over each of those. Hopefully I'll let you see those. I'm just conscious of our time. I'm going to keep going. All right. So anxiety and depression become diagnosable problems. So this is where we're getting into what we would call a disorder. Beyond that normal fear, sadness, they become a problem when they cause significant distress, and or they cause significant impairment in an important aspect of your life. And that can be school, work, relationships, and they're ongoing. They're pretty typical of your experience on an ongoing basis. These would be the key characteristics to show that this is a significant or diagnosable difficulty, is when you have those symptoms, but that they cause significant distress and impairment in some important way in your life, and it's not getting better, it just keeps on going. So here's a natural question: why are mental health problems more prevalent among migraineurs? For those people that have migraines, why is it that these mental health problems are more prevalent, at least double that they are in individuals without migraine? And I think there's lots of reasons why, and I'm not going to be exhaustive on them, but let me give you the ones that come to my mind. So the frequency and severity of migraines increases the frequency and severity of a negative life impact. So look at these stats that have emerged. 85% of people with migraine report substantial reductions in their ability to do household work and chores. Not that we really enjoy doing those things, but 85% of people with migraines say they have substantial reductions in their ability to do these just normal daily tasks. 45% miss family, social, and leisure activities. It's pretty significant. And 32% of people with migraine avoid making plans for fear of canceling because they're going to get a headache. So you can start to see how migraine has a significant impact on people's basic daily lives and functioning. And the frequency and severity of that headache is going to mean a greater amount of life impact. It's like a proportional impact. People with migraines have worse mental health, although better physical health, than people with other chronic conditions. So people that have osteoarthritis or other chronic difficulties. People with migraine are similar, but they have worse mental health than those. And I would muse and wonder about that. Some of my musings are that migraine has been called an invisible disability, chronic pain, an invisible disability. And when you have a difficulty that can't be seen, so the rest of your physical body looks fine. You don't look disabled at all. You can walk, you can even go run in a race or go work out. You can, when you don't have a migraine, you look normal. And even when you do have a migraine, you also can look normal. I think it can lead to all kinds of expectations, both of the self and from other people around, that because of it's invisible, people will have these expectations that I shouldn't have this level of impact in my life. I shouldn't miss so much. I shouldn't be doing more in my house, or there's all these expectations that can come in there, and it can really undermine that mental health, because the distance between reality and expectation is exactly the proportion of distress that people will feel. And so I kind of am not surprised that individuals with migraine will have worse mental health than individuals who have a more observable disability. All right, maybe enough said there. So overall, people with migraine and a mental health problem have substantially lower quality of life than those with neither condition. So if you've got that double whammy, you're going to have a really significant impact. And I think that is pretty understandable. Okay, so how do I know I have a mental health problem? That's a key question. How do you know if you've got a mental health issue? Maybe if you've been paying attention as I've been talking, you might be asking yourself that question. Or maybe you've got a suspicion about yourself, or maybe someone you know and care about who has migraine. So let's go back to that criteria for it being a diagnosable problem: personal distress. So if you're experiencing a feeling, or you have this experience, I feel like I can't cope. I feel overwhelmed. I just feel like I can't go on. I can't even plan, or think about the day after tomorrow because I can barely handle today. That kind of personal distress is a pretty good characteristic of a mental health problem. It would fall into this category, I think, of personal distress. And then that other hallmark, interference in an important aspect of life. So if you have found that your feelings of fear or anxiety or stress, or you're feeling down or sad, or other symptoms that come along with depression, if you're finding that that's actually starting to interfere in your life with an important relationship, with work, with school, you're not going to school, or you're calling in more sick to work, or you're avoiding people in your life because you just don't feel up to seeing anybody because you just feel bad, those would be signs indicating a possible mental health difficulty. And then let's look at that other hallmark, the duration. So how long has this been going on for you? Now, remember I said that for a depressive episode, it's 2 weeks, which is pretty short. Often the duration before people go and seek help is actually much longer. So if you're thinking to yourself, well, I've been struggling a long time and it's just not getting better, that would also be another sign of a possible mental health problem. Another one I want to throw in there is, are there observable changes in your behavior? So if people noticed that you've changed, you're not your usual self, either in your demeanor or in how you act and behave. And here's another one, the emergence of what I might call maladaptive coping strategies, and that's a pretty technical word. Unhealthy coping strategies might be another better word. It's not unusual that when people's usual coping strategies have been exhausted, and maybe they're not helping as much as a person expects or hopes, they might start using other strategies, often out of some desperation for some relief or just escape. And that can include alcohol, drugs, or other types of behaviors. I threw avoidance in here because I think about the avoidance behaviors being withdrawing from people, either because you're just not motivated to be there, or you're just scared to go out and see people. Those would be examples of some negative coping if you're doing that. So these would be some of the clues for you to consider if you're wondering about a mental health problem. Do you need more clarity? So here's some tools. There are some screening tools for depression and anxiety. The most common ones in use today are the PHQ-9 and the GAD-7. PHQ-9 is for depression, GAD-7 is for anxiety. These you can easily Google if you want to look on the internet, and these are available to the public, so they're just freely available in the public domain. Lots of family physicians use them in their offices to screen for depression and anxiety problems. So you can actually find those tools yourself online. You can download them or fill in a questionnaire online about them and get a score. And you can bring that to your family doctor to have a conversation. You can self-monitor using those same questionnaires and track over time if you're getting better, getting worse, staying the same. You can start to see, where am I at here with these symptoms? Another thing you can do is just ask someone who knows you well and cares about you. Often people, if given permission to give you feedback, and you're willing to receive it, often people have lots of really great insights on either confirming that, yeah, I've noticed you've changed, or disconfirming and saying, no, I don't think you've got an issue, or whatever. But you can involve some other people that you know and care for in your own assessment. All right, so this is a downloadable form I found on the internet, and it is a PHQ and a GAD-7 all in one sheet. And I actually use this with my clients in counseling when we're treating depression or anxiety. And we just administer this at the beginning of every session I see them so that we can track over time how they're doing. And this is something that you can do too. So that's one. You'll find other versions online too. So, mental health struggles. If you have migraines and you struggle with your mental health, you are not alone. Pain is not just a negative physical experience, it is a negative emotional experience. And I might be saying this in a way that people haven't really heard before, but pain by its very nature is both physical and emotional. So when you are experiencing a migraine, you have the physical experience of the pain, but you also, by very nature of that pain, you have a negative emotion that's going on at the same time. So pain by its very nature is an emotional experience as well as a physical one. So people with migraines, I think, will have more frequent negative emotions directly related to their pain. So it'll be the more frequent or severe your migraines are, the more frequent and negative those emotions are going to be that accompany that headache. Now, not only that, people with migraines also have all of this life impact from their headache. So it's not just the negative emotions happening during the headache, it's all of the life impact around the headache that then has an emotional an emotional response, or it causes an emotional response. So think about all the ways that migraine impacts your life or a person's life. And I've listed a bunch here, and I could list more. So it's a lot that people cope with when they're living with migraine. Migraines are just an additional life stressor, and sometimes they're very significant. So if you think about the amount of stress we've been living with in the pandemic, start to throw on top of that the stress of living with a migraine in the midst of that too, or lots of other chronic conditions. It's like these are cumulative things, and the more you have, the more it's going to be taxing on your mental health. Okay, so let's talk about some reasons for resistance and reluctance to seek help. I think I'm going to maybe rifle through these because I bet we may have some questions to ask, and I want to leave at least 10 minutes. Are we really already that close to being done? Okay, so reasons for reluctance to seek help. Sometimes people are not ready, and I just want to normalize, if you're not ready, it's okay. Change is a process. It doesn't happen overnight. People go through stages until they reach the point when they're ready to reach out and get some help. There are lots of reasons why there may be some reluctance. The one on the very bottom is migraine specific, which is people with migraine, people will think, there's a typo there, people will think my migraines are psychogenic or psychological. So I think that sometimes can affect people with migraines because they may have been told in the past that their migraine is just a psychological problem. And then if they actually do develop a psychological problem, and they may not want to go get help because then that would just reinforce that misconception that they have felt. And that's really unfortunate. I think it can keep people with migraine maybe from seeking help sooner. So some tips for improving mental health. Lots of things. So these can basically all be summed up with stress management in lots of ways. Managing stress, so positive health behaviors, and they're also really, really good for migraine. They're good for mental health. They're good for migraine. Exercise, diet, sleep, reducing or moderating your alcohol use, substances. Be kind to yourself. Do activities that give you a sense of achievement, pleasure. Have a routine. Get support from others, and then finally reconnect with sources of purpose and meaning in your life. So this can be reconnecting with faith or volunteering, giving back, having that outside connection with something more meaningful than ourselves can actually do really, really good things for our mental health. And some tips. These are basic questions for self-reflection. What are your fears? What are your beliefs? What are the pros and cons for seeking help versus not seeking help? And what would be my advice to someone else if they were telling me all this stuff? That can also often be a good question. And then assess your readiness, maybe set a time frame. If I still feel like this in 2 weeks, then maybe that's my trigger point. So setting a time frame can be helpful. And there are a bunch of resources that are probably available in your community. Do some research on those. I've listed some here. Public health care. Your family doctor, I think, is probably number one when it comes to looking for treatment for a possible mental health problem. I think that a primary care provider, someone who knows your medical history and is already treating you maybe with other medications. This is a really good first line person to go and see. But as I said earlier, develop a team. And that can include other people too, like counselors, mental health therapists, people like me, like a psychologist. And finally, here are some conversation starters for reaching out. Can I talk with you about something? Sometimes it's hard to initiate conversation about a mental health problem. Or even if you're not sure if you've got one or not. But here are possible conversation starters. This pandemic has really taken a toll on me. Start with that. Or I've been having trouble with my mood lately. I've begun to think I might need some help with my mental health. So these are all ways you can enter into a conversation. And then these other resources are also available. I'm not sure if people have access to these slides later. Will they, Randa?
For sure.
Okay, great, because then I can make sure people just can see these, and if they want, they can access this info later. Okay, but we are done now.
That's great.
So thank you, everybody, for allowing me to speak at length about all these things. I really appreciate it. So maybe, Randa, I'll turn the floor over to you if there are any questions. Maybe I'll stop sharing. Yeah, I'll stop.